The framework of traditional Chinese medicine, both tinnitus, ear ringing, and even hearing loss and deafness typically can be caused by excess or deficient conditions. So this could be everything from pathogenic fire of the liver and gallbladder flaming upward, resulting in deafness, tinnitus with headaches, flushed face, bitter taste in the mouth, this kind of upward flaming of fire, where the excess in the liver causes irritability, anger, and is brought about by pathogenic heat disturbing the mind, usually a very forceful and wiry pulse. So even in the case of external contracted illnesses affecting the liver channel, so you can have different things affecting the liver channel, including viruses and bacteria. You can have ototoxic chemicals. Sometimes people even react to something as simple as aspirin, or certain types of antibiotics can also be a little bit toxic and cause this process to happen. And as well as anger, irritability, sudden emotion, fear and fright, truthfully. Sudden attack of fear, fright, and anger can literally bring this on. It can also happen from deficiency. So then we're looking at a kidney Qi deficiency situation where basically water is not nourishing wood. And we see that in this image here. Just bring that in where the kidney, the water element, is not nourishing the wood here. So you can also have that with a yin, shu, yang, kang. So the hyperactivity of yang rising upwards in through the Xiaoyang channels, because those channels go through the ear. So that's really what we're thinking about. Let's see if I can find a picture just overall. Well, here's one of the ears. So the Xiaoyang channels will wrap around here. Sanjiao, gallbladder will wrap around the ear, and that's where you can get into a lot of trouble if these channels are disturbed. You can get a lot of problems. So it can be even from emotional causes, it can be from pathogens, can be from toxins. Many things can affect the ear, and of course the local points located here and even here with Sanjiao 17 or even gallbladder 8 are very common points that we'll see used in this situation, as well as distal points and points nearby like GV24. GB8 and small intestine 19 are very commonly used. So we're going to take a look at a little research and think about how these channels are affected, what goes into ringing of the ear. It's often intransigent. It's difficult to treat. We can get results, sometimes takes time, can be even very difficult to treat, but we can get results in some cases. So it's definitely worth a try, especially if someone's lifestyle is severely impacted by it. Let's start with this article. Now this one is published at healthcmi.com, so go to our newsroom and look at our research that we publish. We do original research. We also publish other research from different languages, as well as English language stuff all over the world. And let's take a look at this one. Acupuncture tinnitus relief efficacy confirmed. So a randomized double-blind clinical trial by researchers at Guilin University of Medical Sciences has demonstrated significant improvements in tinnitus, sometimes in some countries pronounced tinnitus, loudness, and severity in patients receiving acupuncture compared to a placebo group. So people can often get low frequency tinnitus, they can get high frequency tinnitus. Sometimes the high frequency tinnitus is associated with excess, and low frequency can be deficiency. It isn't always the case. It can even be damage to the structures of the ear due to loud noises, for example, is another cause that we know, just external injury, and we say injuring the channel, but actually injuring the cilia of the ear and causing many problems in the anatomy of the ear itself when there's loud noises. So we'll take a look at that here. So of course, exposure to loudness, we really want to focus on protecting the ear, especially in loud environments with hearing protection devices. So this particular one on tinnitus was a trial of 88 patients. And yes, it's not an enormous sample size, but sample size really is all about funding. So not bad for Chinese medicine to get a sample size like this. Now with our meta-analyses, sometimes those can be sample sizes of thousands or tens of thousands of people. This is an individual trial. So let's take a look. So this is chronic non-pulsatile tinnitus. So in other words, it's not the kind that pulses on and off with something like a heartbeat or a bodily organ type of response. There are many kinds of tinnitus. High frequency, low frequency, hearing sounds in the body, whooshing sounds, and again, it can be even from something like multiple sclerosis can cause it, many causes. But ultimately, we're looking at the Shaoyang channels of the ear getting damaged, a triple burner, the gallbladder channels, the small intestine channel, and we're really trying to take a look from a diagnostic perspective of whatever is causing the ear ringing to heal the channels, thereby healing the circulation and nourishment to the ear. So the acupuncture group was 26 males, 18 females. Placebo group, 27 males, 17 females. Each group underwent 15 treatments, 3 times per week for 5 weeks. I know that's a lot, but even in my own personal experience and many other acupuncturists we work with here at Health CMI, we find that to really get at tinnitus, we need a fair shake at it, and it just takes more treatments than what normally you would need to do for many conditions. It just requires more work. And so that gives us a fair shot at making a dent in it. The placebo group received sham acupuncture, in which non-penetrating needles were placed at non-acupuncture points, locations to kind of mimic the acupuncture experience. So that's interesting because it's still acupuncture. They're just Ashura points technically, but it's not at the actual points that do the work. And that's very important to get right into those primary points like small intestine 19 or gallbladder 2 or something, triple burner 17, things like that, to really get the oomph we need to fix this problem. Primary outcomes were measured using the visual analog scale for tinnitus loudness and tinnitus severity, the TSI, and they were evaluated at the baseline and then at the 5th, 10th, and 15th sessions, and 3 weeks post-session. Which is very important. Sometimes people respond to anti-inflammatories or steroids, non-steroidal anti-inflammatories, but the question is can someone get results long term? And they're going to take a look 3 weeks past and see if it's holding. I'd say in my own clinic, before we even get started, in some ways I just give them a realistic outlook. It's 50-50. We can sometimes reduce the volume a little. Once in a while, we can eliminate the issue in one or both ears, not necessarily in both ears, right? Or just bring it down a little bit. But we hopefully can make some benefit to the system to help people. So the acupuncture treatment was performed using sterile, single-use filiform stainless steel needles, so basic acupuncture needles. These are relatively thick here, 0.3. That's a 30 gauge, 1-inch needle, we would call that, 0.3 by 25 millimeter. Needle retention time was 30 minutes per session, and manipulation techniques included twisting, lifting, and thrusting to elicit Dutchie. As in all of our research we publish, you can see a little bracket there, so that if we went to the end of the article, you can see all the sources that we list. And let's go to the very end. And here's, for example, sources. So we do quote the research itself to kind of give you an idea of where this information is coming from. So this is, again, Nickwayland University research. Do I think we need to rely on a 30 gauge needle for this? Probably not, especially in those local points of the ear. In my experience, you're fine. Use a 34 or 36, maybe even finer gauge needle. I don't know that we need to go full on 30 gauge. From my own experience, I would say I wouldn't do that. However, this research is focusing like that. And if you look at the history of Chinese medicine, 150 years ago, in many areas, that's all you got was something that was 3 times thicker than a 30 gauge. That's all that was available. But in the modern times, we do have kind of very high-tech, very nice needles available to us. Let's take a look at some of the list here. So gallbladder 2, Ting Hui, gallbladder 20, Feng Chi, Sanjiao 21, men, small intestine 19, small intestine 17, Sanjiao 3, Sanjiao 5, so Zhengzhu, Waiguan, large intestine 4 and small intestine 6, so Hegu, Yang, Lao. So these are the points they used in the research, and a nice looking set of points. I would agree those are important points. Again, going to one of our images, let's pull it up, of some of the more common points. Here they are. These are probably the big three for tinnitus. So triple burner 21, Ermin, small intestine 19, and gallbladder 2, all available in this study. No surprise there whatsoever. So, and maybe tucked over here, a triple burner 17 or above the ear, 1.5, so that gallbladder 8, might be used. But these are the big three. There is really no tinnitus treatment without Tingong, all right, or benefiting hearing. It is the #1 point in Chinese medicine. And I do the three together. I know Professor Ming-Ching Zhu would do a couple scalp points. He's a scalp acupuncturist, but certainly Ming-Ching Zhu and the people he trained would be using these 3 points simultaneously as well. Is it a comfortable treatment? No. You do needle these with the mouth, the jaw, slightly open. But you could expect a fair amount of pain during this treatment. You could sneak them in and make it comfortable, but this is a rather forward, aggressive treatment required to benefit the ear. And you might add points like gallbladder 8, even gallbladder 12 down here is another good one. There are many points that work. Gallbladder 20 is another one. And these are all the ones you'll see coming up in a lot of research. Even Du 16 in the back of the head, GV20 when there's yang uprising, or Sushen Sung, things like that, Yin Tong, right? GV24, very common. A lot of points just focusing on these channels locally. Even points like large intestine 4 and liver 3, of course, bringing that qi down, settling the yang, anchoring the yang. Sometimes there's a lot of neck problems and pain in the neck, and it's causing problems of the channels of the around the ear. So you're going to go with those Jia-Ji points. There's many approaches you're going to use. And we'll even cover small intestine 6 and small intestine 3 here, because those are distal points along the arm and hand that are very beneficial. So there's a lot to choose from. We're not going to get confused by that. We're going to say we have a lot of things in our palette, but they're always going to come back to these big three. All right, and we'll go over these one by one, these points, since they're the ones featured in the article. And I like this article because it really focuses on the main points. So let's look at this article, then we'll back up and really get into detail on the acupuncture. Again, we're going to follow our diagnostics as well. So at baseline, the scores were comparable in both groups, control and treatment group. And they compared scores afterwards. And the treatment group, of course, had significant improvements in scores. And the placebo group exhibited a less pronounced reduction, even with reductions in scores. Because tinnitus can worsen in time. It's statistically significant outcomes. Basically, real acupuncture significantly outperforms sham acupuncture. They found some findings. It's worth trying the treatment. We're not promising the sun and the moon on this because we don't know if we can help them. But we do know it's worth a try, and in so many cases we can help people. So beyond subjective improvements, the study was also analyzed biomedical markers. So serum cytokine levels. Post-treatment blood samples showed a significant decrease in pro-inflammatory cytokine. These are biochemical agents that help cells communicate. And we see after treatment that TNF-alpha, tumor necrosis alpha, and interleukin-1b, inter-1 beta, was better off in the acupuncture group, came down lower. So inflammation came down, measurable by TNF-alpha and interleukin-1 beta. So great, acupuncture brought inflammation down, and we can measure that. fMRI, so functional MRIs, image studies revealed enhanced neural connectivity in the auditory cortex, particularly in the superior temporal gyrus and prefrontal cortex, areas implicated in tinnitus perception and modulation. So a lot of benefit to the neural auditory cortex using MRI. So that's interesting. And cortical plasticity measured, changes that acupuncture may modulate hyperactivity of the central auditory pathways, contributing to tinnitus relief. So, that's what we would call things like Shaoyang channel issues, for example, even kidney and liver channel issues, excess in the channel, and helping to calm and soothe that. Sometimes by nourishing kidney water, sometimes by releasing excess off of, let's say, the Shaoyang channels. Clinical implications. Okay, the study provides strong evidence supporting acupuncture as a viable treatment for chronic non-pulsatile tinnitus, particularly when standard interventions fail. The detailed acupoint selection, treatment frequency, and stimulation techniques outlined in this protocol can serve as a clinical reference for licensed acupuncturists, etc., etc. So let's see. Acupuncture significantly reduces tinnitus loudness and severity with sustained improvements post-treatment. That was that 3-week follow-up. And again, it was subjective, objective, and biomedical measures give us strong evidence. And so that's that piece of research. And pretty good, though. And I like that. Let's zoom in on some of these points they covered. We'll just start at the top with gallbladder 2, Tinghui, and we'll go from there, because I think we do want to at least discuss the relevance of these points. So the meeting of hearing, gallbladder 2. Let's see if I can bring up a picture of that. Might have one. Well, it's right there in the main picture. I was hoping to zoom in. But I think that's what we have for that. I mean, we have some kind of like this, but that's not as great a picture to look at. So let's focus on this. And again, I do these 3 myself at the same time. And in this research, it does look like that's what they were doing. So gallbladder 2, meeting of hearing. That's kind of a tip off that we're somewhere. And you see here 2 Shaoyang channels right there, triple burner and gallbladder, and then flanking the small intestine channel in the center, right? This is in the hollow between the intertragic notch posteriorly and the condyloid process of the mandible interiorly. It's located with the mouth open. And basically ask the patient to open the mouth, and the condyloid process of the mandible slides forward, and it reveals the point in the depression. And that's how you get there. It'll kind of open up for you like a door. And then right above that is your small intestine 19. Typically, people needle this posteriorly, half to one sun, but a lot of it's perpendicular. And yes, you can close the mouth after insertion. Just slowly and gently, no sudden movement. So this point specifically benefits the ears, eliminates wind, and clears heat. So whether it's external pathogenic factors, could be COVID-19, influenza, any kind of bacteria, things affecting you, even attacked by acute toxicity from an antibiotic or a drug, it's going to be helping to eliminate that toxic reaction, right? And wind. It also activates the channel, alleviates pain, but it's also nourishing. Remember, it's going to nourish the ear. So tinnitus, deafness, redness and swelling, even itching of the ear, We use it a lot for other things, toothache, wind stroke, mumps, many things, deviation of eye and mouth, jaw problems, things like that. Great point. Again, classically combined with a triple burner 21, Sanjiao 21, and small intestine 19, Tinggung. So the 3-point combination. If we go to our next point, gallbladder 20, that's a favorite. Well, certainly if you have neck pain, you want to go after that as well. Or wind attack. The wind pool, feng shui, is the name of the point. So let's see if I can bring up that in our something. There we go. That's a nice picture. Gallbladder 20. And again, these channels are all running up through to the ear. So you get a nice idea here in this picture. So it's the meeting point of the gallbladder and Sanjiao channels. So again, they meet here with the yang motility and yang linking vessels. So you've got some extra channels linking there with the Sanjiao channel, and they all meet here in the pool of wind, or wind pool, Sang Chi. So very important point. And again, this is below the occiput and the hollow there, approximately midway between GV16, governing vessel 16, and gallbladder 12. And it's between the origins of the sternocleidomastoid and trapezius muscles. It's a nice ditch. Most of us can find it relatively easily. We use it for all kinds of conditions. This is one of the more used points because it's so unbelievably useful. Love this point. Eliminates wind, benefits the head and eyes, clears the sense organs, stops pain. We use it for everything from headaches and dizziness, visual problems, deviation of the mouth and eye, insomnia sometimes, with points like Anmian nearby, loss of memory, epilepsy, attack by wind and cold, for example, even wind and heat, swelling of the face, redness of the eyes, a lot of eye stuff. Deafness, tinnitus, blocked ears, all kinds of hearing problems. Again, that Shaoyang channel. Nosebleeds even, and stiffness of the neck, of course, things like turning the head and all that. It can technically also be good for pain of the lumbar spine. So many uses for this unbelievably useful and incredible point. So we definitely had to cover that one. Now, if we go to triple burner 21, now back to the Shaoyang channel here at this point on the triple burner channel, Sanjiao 21, TB 21, SJ 21, however you want to use the nomenclature. Let's see here, triple burner 21. Voila, there we are at the top now of our big three. And so it's the depression anterior and anterior to the supratragic notch. So do you see that little notch there that's pointed out in the picture? Just go in front of that. And slightly superior to the condyloid process of the mandible. And a nice ditch will open up for you when you open the mouth. So pretty easy to locate also. Usually inferior and oblique insertion. Maybe slightly posteriorly, half to 1 sun. Remember, it's a delicate spot. Some texts say don't use moxa here. Benefits the ears, clears the heat, so tinnitus, deafness, all kinds of hearing problems, earaches, all kinds of problems like toothache, a lot of stuff like that, headaches, neck pain. So triple burner 21, extremely useful. And of course, getting to the big one of all, small intestine 19, Tinggang. Many of the older Chinese medicine professors that trained me would always say it's always going to come back to this when you're dealing with the hearing problems, and you're going to the palace of hearing, Tinggang, palace of hearing, meeting point of the small intestine, Sanjiao, and gallbladder channels. That says it all right there, right? So again, with the mouth open, the point is located in the depression in the middle of the tragus and the condyloid process of the mandible. So let's look at that, right dead center there. There's the tragus, dead center, and you go out, and here you are. Supratragic notch, triple burner 21, intertragic notch, and you're coming up on GB2. So pretty clear. Again, open the mouth, and the mandible will slide forward and really feels a nice depression. This is basic. This one's a perpendicular insertion, almost always, half to 1 sun. Close the mouth gently. Again, benefits the ears, calms the spirit, deafness, tinnitus, even like discharge from the ear. A lot of mental problems, mania, epilepsy, lost voice, toothache, other things. Hugely important point. So that's crucial. And why I like this research is specifically because they're really hitting all the right points on this. So I like that. It's just mainstream medicine here. They're not doing a particular system of one or another. We can do that or add that, but we still need to come back to small intestine 19. Sanjiao 17, which we touched on before we spoke about that. Sanjiao 17, windscreen, meeting point of the Sanjiao and gallbladder channel. So a very important point right around here. And let's see if I can bring something up to reveal the channels around there. Well, this might show us a little bit. Well, there it is. Right there. Sanjiao 17, not entirely. What's the ditch behind the ear? It's the behind the earlobe, in between the ramus of the mandible and the mastoid process, which is that big bone behind there, in the depression just superior to the palpable transverse process of the first cervical vertebrae. So you'll find a nice ditch there behind the earlobe, and you can, just find the earlobe and go under there, and you'll feel that ditch behind it, and there you go. Perpendicular toward the opposite ear, basically half to one sun, and benefits the ears, eliminates wind, clears heat, activates channel, stops pain, deafness, tinnitus, itching inside the ear, all kinds of earaches, but deviation of eye and mouth, toothache, mental disorders even, manic disorders, spasms, pain of the teeth and gums even, swelling of the cheek, a lot of local stuff. Hugely important point. And again, that's something I might want to add. That's a nice little extra, right? Because it will get the job done. It's definitely central to this process of treating the patient. Sanjiao 3. Now let's get into some distal. Okay. Zhengzhu. Okay, central eyelet, the shoe stream and wood point of the Sanjiao channel. So we're going to the hand. On the dorsum of the hand, just proximal to the 4th and 5th metacarpophalangeal joints. So let's try to bring something up for that. Sanjiao 3. There we are. And so Sanjiao 3, that's interesting, right? Because this point is known for benefiting the ears. It clears the heat, clears the head and eyes, activates the channel, alleviates pain. So, okay, so this is on the dorsum of the hand. Again, it's in the depression just proximal to the 4th and 5th metacarpophalangeal joints. So does that, I don't know how well it shows that, but it's just proximal to that on the hand. And it, so if you kind of rest the hand in a loose fist, it's at the apex of an equilateral triangle formed by this point in the prominence of the metacarpophalangeal joints of the ring and little fingers. It's relatively easy to find. And so Sanjiao 3, and it's perpendicular or oblique insertion proximally, if it's oblique, about half to one sun, clears heat, benefits the ears, clears head and eyes, activates the channel, alleviates pain. It's for tinnitus, deafness, earache, ear all day long. Sanjiao 3, very famous for that. It can be for other things in febrile diseases, chills and fever, itching of the body and face. Of course, it's great locally for the hand, like problems with the fingers and flexing the hand and things swelling like that as well. So Sanjiao 3, it's good to get in with some distal points. Sanjiao 5, perhaps one of the most famous of all the acupuncture points. Triple burner 5, there's calling it here, TB5 or SJ5. Guan outer pass. Now, we use this a lot in Chinese medicine, right? Because it's a low connecting point of the Sanjiao channel and confluent point of the Yang Ling King vessel. So Sanjiao 5, Guan. confluent point of the yang linking vessel. And again, low connecting point to the Sanjiao channel. So it's 2 sun proximal to Sanjiao 4. Depression between the radius and ulna on the radial side of the extensor digitorum. About as common a point as you're going to find, right? It expels wind, releases the exterior. We use a lot for like wind and cold, chills and fever, things like that. Benefits the head and ears. Again, also good for, opens the yang linking vessel, clears heat, and of course for stopping pain, activating the channel. Deafness, tinnitus, headaches, vertex headaches, frontal headaches, any kind of headache. Wind dizziness, swelling and pain of the cheeks or tongue, toothache, mouth ulcers, redness and pain, swelling of the eyes, pain of the shoulder and back, stiff neck, all those kinds of things. It's just, this is a very powerful point, so it has a lot to offer, Sanjiao 5, especially if there's problems in the immunity, the benefiting the Wei Qi or the protective shield around someone. Sanjiao 5 is great. If there's a wind attack of something, we might want to use this as an incredible point to use. And then going from incredibly common to incredibly more common, if possible, large intestine 4, another huge point in Chinese medicine. Hitting the big guns here today with large intestine 4. Do we have a picture? I don't know if you have one of that. Yeah, we do have one today. So Hegu, joining valley. So Yuan source point, a large intestine channel, Gaowu command point, Matanyang heavenly star point. We couldn't possibly cover all the indications and functions of this point, but again, it's on the dorsum of the hand between the first and second metacarpal bones, between the midpoint of the second metacarpal bone and close to its radial border. It's perpendicular, 0.5 to 1 sun, or oblique maybe, proximally 1 to 1.5 sun sometimes. Technically, it's contraindicated in pregnancy, so, but good for the defensive qi. The Wei qi adjusts sweating, expels wind, releases exterior, regulates and benefits the face, the eyes, the nose, the mouth, the ears. Who doesn't use this for headaches, right? So common for that. Activates the channel, stops pain, induces labor, restores yang. And so exterior wind problems, chills, fever, febrile diseases of many kinds, headaches, one-sided headache, bilateral headache, whole head headache, hypertension-related headaches, hypertension itself, pain of the eyes, nosebleeds, runny nose, sneezing, nasal congestion, toothache. Just trying to list a few. Painful throat, kind of a problems like swelling of the face and eyes, Bell's palsy stuff, deviation of the face and eyes and mouth. We use it sometimes when there's prolonged labor or even amenorrhea to get things flowing again. Sometimes, again, it's on the large intestine channel for digestion issues, including dysentery and things like that. Wind rashes to release rashes. Pain of obviously of the local area is very good. Including problems with the fingers and hand. So huge point, but again, something used in the study and yes, can benefit the ears. So, but not just the ears, a lot of the sense organs so it's something that's enormously valuable. And finally, in this list, we got through all the ones on this research. Small intestine 6, Yang Lao. Not as common as large intestine 4, perhaps, but still a major acupuncture point. Small intestine 6, Shi-cleft point of the small intestine channels, especially for acute issues. Let's see if we have some kind of picture of that. Oh, there we go. How do you like that? Small intestine 6. So support the aged. So this is when the palm of the hand is placed on the chest. It's on the dorsal aspect of the head of the ulna, in a cleft there. And so basically, if you lie down with the arm by the side and the hand prone, let's say the palm on the acupuncture table, if you place one finger at the high point of the styloid process And ask the patient to place their palm on the chest, and they turn and rotate that hand toward the chest. There's a cleft or a little hollow, a little ditch that forms, and that is located in that ditch. So you're going to go to the styloid, the ulnar styloid, right? And it's this big bump at the end of the ulna. And when you turn the hand inward toward the chest, this ditch appears, and that's small intestine 6. A lot of people know it for benefiting the eyes as you get older. It's for eyesight. But yes, also ears benefits the channel, activates pain stuff. It's good for shoulder and arm pain, good for acute conditions, shoulder pain especially, stiffness and pain of the shoulder and back and arm, things like that. Of course, local pain, even lumbar pain. Difficulty sitting and also rising up again, contraction of the sinew of the hand. But dimness of vision, blurred vision, eye pain, a lot of eyesight stuff, but also good for the ears. Probably more known for its benefiting eyesight. So pretty neat points that they covered there. And that was that piece of research on acupuncture, tinnitus relief efficacy confirmed. Kind of an interesting exploration into treatment of tinnitus. It's not the only piece of research that we find on that. There's a whole lot that we can cover on that. And we'll briefly touch on some of those pieces of research and take a look. So here's another one that was published at Health CMI, Acupuncture Tinnitus Relief Confirmed here. And this one was at the Second Affiliated Hospital of Heilongjiang, very famous university. They had warm needle acupuncture outperform manual acupuncture, 86.67% to 76%. And so let's just see how they did it and kind of get into it. So warm needle group, 5 cases recovered, 16 cases significantly effective, 5 were effective for the 86.67%. So this was 30 cases in each group. And here's what they did. Now this is interesting. Of course, they did the big 3 that we covered, small intestine 19, gallbladder 2, triple burner 21. They also triple burner 17 we covered. But they added small intestine 4, which is a nice addition. Again, we talked about small intestine 3. Maybe they went for small intestine 4. Why not, right? Again, that channel is going to benefit the patient. That's the Yuan source point of the small intestine channel. So perhaps very beneficial. Used a lot with damp heat stuff at that point. But this is the one I think is interesting. C2 through C6 Jiaji points. And yes, you can call the neck Jiaji points proper. It depends what historical text you're talking about. Some historical texts say Jiaji points start below the cervical vertebrae, and some include the cervical vertebrae. So I think we have a picture of that. But again, if there's a lot of problems in the neck, in the channels of the back of the head, you're really risking problems with hearing, definitely, because the channels are going to be disrupted going through the head and face. And that's why the neck Jiaji points can be sometimes really helpful. But there's a lot of tightness, disc swelling, nerve impingement problems. You want to get that nice, supple circulation of qi flow. So that's nice to show this piece of research. They use the big thick needles for the most part. But the ones at the ear were a little thinner, 0.25 millimeter. So a little bit better there. Mild reinforcing attenuating technique was applied, and needles were manipulated every 10 minutes for a total of 30 minutes. And they did a treatment daily with 6 consecutive days with 1 day rest, completing 1 treatment course. And they did that 2 times over. So interesting. 6 days in a row, 1 day off, then 6 days in a row. But, if you really want to go after tinnitus, you're going to need that frequency. And the warm needle acupuncture group, let's see, they did some distal points as well in that group. So they're comparing this group. Now this group got, what did they get? They had 76.67% result using this set of points. And then the 86.67%, they did this one. So added gallbladder 20, triple burner 5, triple burner 3. But it looks like they took out the small intestine 4, for example. So similar points, but they added some moxa. So after achieving dead chi at the points, they used 2 centimeter moxa pieces were connected to needles at the jaw G points. So they did warm needle acupuncture here. And, similar treatment course. So that's that piece of research. And again, like all of our research, we show you the source and where it came from. And there's other research too, but I thought that was interesting specifically because we talked about the jaw G points being very beneficial, and I think that does add to our understanding. So you're going to see that could be in chronic cases with degenerative disc disease, for example, or if something acute like emotions is disturbing the Shy-Yang channel, you still want to make sure the channels going to the head are getting nourished. So you don't necessarily have to do all the neck jaw G points, but you can do some. And if there's problems there, you're probably going to want to work on that. Let's get back to our research. That's not all. There's more. Here's another one. Shanxi Hospital also. And let's see what they did. They had electroacupuncture, 86.67%, and manual acupuncture, 70%. And so they're just comparing different types of treatment, what they can get. And the symptoms included hearing, loss of hearing, headaches, anxiety were prevalent, along with the ear ringing. And they very much pointed out that people's mouths were open during needling. And they used 1-inch needles, and what they do, there it is. You see, we're seeing the trend here. Triple burner 21, small intestine 19, gallbladder 2, triple burner 17. So the big 3 and triple burner 17, these are pretty much heavy hitter points that are going to get the job done. And did some distal points here. Triple burner 3 once again, triple burner 5 once again. Gallbladder 43, nice addition. Some people use gallbladder 41. And kidney 3, maybe nourishing that kidney chi. Now the points that received electroacupuncture, I don't know that they're going to give us how they did it. Let's see if they'll give us the details. So they did the local points of the ear with electroacupuncture. So after achieving dead chi, getting the points stimulated, triple burner 21 was connected to gallbladder 2. And triple burner 17 to small intestine 19. Now that's interesting. So triple burner 21 to gallbladder 2. Triple burner 21 to gallbladder 2. Okay, they're running it right through Tinggung there. And then they're going triple burner 17 to small intestine 19. Interesting, right? Again, triple burner 21 to gallbladder 2, and then triple burner 17 to small intestine 19. The center of the vertical auditory area, scalp acupuncture was added with 1 centimeter above the ear tip and stretches 4 centimeters in width. So again, the vertical auditory area, the scalp acupuncture line, which is 1.5 centimeters above the tip of the ear and stretches 4 centimeters in width. So also received electrical stimulation through that. Needles were placed at the either end of the region pointing toward each other with a 15-degree angle to the skin surface. So that's interesting. Insertion length was 2 centimeters. A dispersed dense wave was used, and the frequency was 20 hertz, moderate stimulation. So, until patients could feel it. So I think, I don't have a picture of that particular line, but basically it's basically level with gallbladder 8. So you can imagine 1.5 cent up, right? And then that 4 centimeter line that we're talking about you know, because I'd say gallbladder 8's about 1 sun above the ear apex. So you would go a little bit above, just a pinch above, and it's that 4 centimeter line, let's say here. And then they're doing one needle here, pointing towards the other needle here, and that's what they were doing, you know, because that's one sun above here. So you would go just above that. And so that's neat. Again, that would be roughly like this. So pretty interesting addition there. Whole lot of electrical acupuncture, right? And that's this research, and they did that. So I'm glad we covered that one. That's a very different approach. We had some moxibustion, you had some warm needle acupuncture, then you had the electroacupuncture. Let's take a look at another one. Here's some gallbladder 8 and Qigong again. Small intestine 19. Let's see. Now, Heilung Zheng did this one. I don't know. Did we cover this one already? Electroacupuncture. Let me see if we covered this one. They did otoscope and hearing examinations. Slightly different. This is slightly different. So they did a jaw G point, triple burner 17, small intestine 19, gallbladder 8, gallbladder 2 in this one. And treatment was once or twice per day. Okay, that's going to be hard for 21 days. So that's going to be difficult to pull off in most clinics with 1 day break and every 6 consecutive break every 6 consecutive days. So, okay, so once to twice per day over a total of 21 days and a 1 day break every 6 days within that. And they used very thick needles, very long, thick needles for this. Needles were retained for 30 minutes after saving Tai Chi and twisted every 5 to 10 minutes. So the Jaji points were connected to the electroacupuncture device. It didn't really specify which ones, I don't think. So that's that one. But again, you know, no shortage of information. Again, and it's important to see all this research. Here's another one. Because why? Because it is hard to treat, but we don't want to be discouraged. We want to go after this and really give our patients hope because we might be able to get the job done. So it means a lot to people when we do get it done. So these people had acupuncture plus topical herbal medicine. Here's another approach. Total effective rate of 93.5%. Now remember, total effective rate doesn't mean cure rate. It just means they had some good result. Let's see what they did. So treatment was administered 30 minutes per session on alternate days for 10 weeks. Thick 30 gauges needles were used again. Once again, even Professor Ming-Ching Zhu, I think he was using 34s or 36 gauges, not 30 gauges. So I don't know that you really need to go that thick, especially with these local points. And you can see the cast of characters are pretty much what we've covered. We didn't cover gallbladder 28, but pretty much we covered the other ones already. And so it shows you that regardless of the, actually I think this is gallbladder 8, come to think of it. That too is a typo. Yeah, that looks like a typo to me. So no, gallbladder 28. That wouldn't make sense entirely. Yeah, so that is a typo, right? So that's gallbladder 8. So this is all points that we've already covered. Small intestine 19, gallbladder 12, triple burner 17, gallbladder 8, triple burner 3, triple burner 5, gallbladder 20, GV 20, governing vessel 20, and yin tang. Well, I don't know if we talked about yin tang, but good choice. And yin tang, should have a picture of that somewhere. I always try to pull these things up if I can. Very peaceful point. You know, especially, remember, we can't underestimate how stress, anger, irritability can congest in these channels and irritate the hearing. Excess caffeine excess emotional, physical stress, lack of sleep. These things can also burn out the yin and cause chronic problems to have yin deficiency with yang uprising, and the emotions themselves injuring the channel. So great selection of points. Again, the research is right on. And nothing unusual here that I'm seeing in the study. Now, what did they do? In addition to acupuncture, and this is what's the fun part, Bing Pian, and it depends where you are whether you can get Borneolum syntheticum. They're using the synthetic variety of Bing Pian. I don't know that it's necessarily legal in every country. Check availability. It was placed inside a tube 3 to 5 centimeters in length and 0.4 by 0.6 centimeters in diameter, made of a fistular onion, xiaochang. So they took an onion, and they, a hollow, and they filled it with Bing Pian, and then into the patient's outer ear through the tube. Interesting. I'm not sure how clear that is, whether they blew it through there into the ear, or they placed the whole thing into the ear. It's not quite clear. And then a minimum of 6 hours. But very interesting. Basically applying Bing Pian into the ear. So that's kind of interesting in that piece of research out of Anhui University. Now let's go over to here. Tinnitus attenuation out of Liaoding City Hospital. You see, you're getting the idea that there's a lot of research, and there's a reason why we need this research. But hopefully what your takeaway is, you're like, wait a minute, I can do this. I get it. I see where they're all coming from. These are very similar treatments across multiple pieces of research. So they're comparing acupuncture with hyperbaric oxygen. 77.5% effective rate with a 50% in the hyperbaric oxygen. So they look for symptom severity, duration, impact of tinnitus on sleep and mood and attention. And I give you all the stats in the study of what they're covering, of course. This is nice. Biomedical diagnostic criteria included tinnitus or hearing loss without obvious pathological changes to the tympanic membrane or external auditory canal and a reduced sense of hearing. And the TCM diagnostics part of this included, now this is interesting, liver and kidney yin deficiency, which can cause that tinnitus, which is present day and night with a worsening of symptoms during the night, heat in the 5 palms, headaches, dizziness, dream disturbed sleep, pain and weakness of the knees and lumbar region, night sweat, dryness of the mouth and throat, nocturia, and red tongue with sparse coating and fine wiry pulse. So kind of interesting, isn't it? Nocturia just means waking up at night to urinate. So we're seeing a lot of kidney yin deficiency, kidney qi deficiency issues there. Treatment, they received some hyperbaric oxygen, daily, conducted daily and lasted 80 minutes with 2-minute break, 10 treatments and 30 minutes each. So that's, done in probably a hospital setting. So then patients were assigned a group. They were given Lu Wei Diwan Wang, a classic herbal medicine formula for kidney and liver yin, and 6 grams twice daily. And then they were given, and, I think we're going to see the same old thing here. And sure enough, small intestine 19, gallbladder 2, triple burner 21 are the front 3. We've seen small intestine 4 come up before. Nice to see you back, small intestine 4, right? So that's interesting also. And gallbladder 20, once again, liver 3, large intestine 4. Stomach 36 is added, and no surprise there. Nourishing and benefiting. So they're thinking about those deficiency issues here with the diagnostic patterns. You could see they were going after deficiency. So stomach 36 for the qi, and then bladder 23 for the kidney qi, and benefit the kidneys, yin and yang and qi with the kidney channel on the back shoe points, bladder 23. So that's their angle of attack. And they show good result. But again, they're adding, basically looking at tinnitus due to liver and kidney yin deficiency, adding Lu Wei Di Wan Wang. So a little bit of herbal medicine in there. That's very nice. And it's good to look at that. Okay, let's look at a couple more here or there. And I think we looked at this one. See what local points. Oh no, this is slightly different. But again, this piece of research did the same. We're going a little bit back in time, but again, this one was rising liver heat, some of an acute situation. So they used Longdan Siegantang. So they're going after liver and gallbladder damp heat with that. And they added liver 3 to that study, for example. So kind of interesting also. So yeah, you can have liver and gallbladder damp heat affecting the channel as well. So one went for deficiency, and this particular one went for excess, right? Acute coming on. If you see that liver, gallbladder damp heat, then they're going to go. But it did scalp acupuncture in the vertigo and hearing area, and triple burner 21, small intestine 19, gallbladder 2, triple burner 17, liver, large intestine 4, liver 3. So the acupuncture, even regardless of diagnostics, is really going to be similar. Now, some of you might be thinking for that deficiency one, why not Erlong Zosa one? Now, Erlong Zosa one is similar to Lu Wei Di Wan Wang. It's got Shu Di Huang, Shan Zhu Yu, Shan Yao, Fu Ling, Mudan Pi, but it's Zixie Si Shi, magnetitum, because that's going to benefit yin, nourish kidneys, augment tree, improve vision, hearing, but it's going to be specifically for improving hearing and descending that yang. Shi Chang Pu has a little Shi Chang Pu in it, and Wu Wei Zi. So Si Shi, C-I space S-H-I, magnetitum, is specifically for that rising liver yang issue, for example, causing tinnitus. And so that variation of Lu Wei Di Wan Wang, or is Erlong Zosa one. And it's sometimes it's translated as pill for deafness. That's good for the left kidney, referring to the yin and yang aspects of the kidney. And here they're going after Longdan Siegantang, and they got good result with this one. So for acute, let's see, now we're going back all the way to 2017. Another piece of research, and sure enough, small intestine 19 was the main focus on this one. And let's see if there's anything unusual. Not so much, right? Same old points. They did some secondary work. So if they had cheese stagnation, they added some points like large intestine 4 and spleen 6. Qi and blood deficiency, they added CV6 and stomach 36. If there was a gallbladder fire, we saw that before. They're going after more intense acute stuff, hyperactivity of liver yang or gallbladder fire. They added liver 3 and gallbladder 40. That's a good one, actually, for tinnitus, gallbladder 40. Kidney Qi deficiency had a kidney 3 or CV4, conception vessel 4, Guanyan. And Qi and Yang deficiency of kidneys, so bladder 23, governing vessel 4 being men. And hyperactivity affecting the liver, triple burner 3 and triple burner 5. So similar points and some supplementary points. And they had another study over here. You can see they even put in some Ashur points, which is kind of interesting. So there isn't always going to be huge variations in the point selection, I would say. I think that's fair. You're going to see some variation, but not as much. And they're just listing a whole bunch of studies here. Study after study after study was sitting all listed here. There's another picture of some local points. And once again, this study, they're adding kidney 15s. Hey, they something new for us today, right? You know, so little variation, again, getting results and nothing that unusual. Occasionally, you'll see something different. Here's a, hyperactivity of liver and gallbladder fire. They're going to add heart 8 and 9, for example, or something like that. And they got good results. They did some herbs. Here they did Erlangsosuan, which we talked about. And there's that susha I was talking about. This is a variation. It's got muli in it, Lungu and muli. So it's this is a modified version of Erlangsosuan. So the Lungu muli more to calm the spirit and also settle and anchor the yang. So it's a variation. It's very similar to Lu Wei Diwan Wang, but it's special for hearing. The susha is going to be in the traditional formula itself of Erlangsosuan, but they've made some additions like this Lungu and muli. And if they had hyperactivity of liver, yang, and gallbladder, that yellow greasy tongue coating, and they've got all that liver fire going on. Maybe there's an external contracted illness. They're going to do some variation of Long Dan Xie Gan Tang. It's a very powerful, clear heat and damp, clear toxins from the body type of stuff. Heart fire, they did some stuff, had some herbs for that. Unrisen lucid yang, so lack of qi and blood circulation to the head. Different things that they show. And they got good result here, lots of goody points, no big surprises. Another one, here we go. I only got one or two more to show you. Thanks for hanging in there, but I wanted to show you, Halcyon, we got a lot of research on this, and we're seeing people get results, so I don't want people to be discouraged if they can't get the majority of the cases better. You're still going to help people. And you can see how to do it too now. And all of these articles, even if you don't have immediate access wherever you are to materials we've given you, are available online and things, remember that it's always in our newsroom. Some master tongue stuff here for acupuncture. So there's all different systems that you can use. So some of Master Tung's points here. Wan Shu Yu, Wan Shun So they've added that to the standard points that you would normally have, for example. And so always, a lot of great points, including things like this, to guide us. And so, you can add proprietary points, and those points are located on the hand, by the way, so on the ulnar side, so kind of level. So if you go with the little finger along the bone by the ulna, and so let's see here, they might look like this. There you go. And for example, but again, you might want to go with just some small intestine points. And you're right in there. And here's a kidney 1, for example. Again, no big news there. Here's another one. Similar points once again, with Yiming the extra point as well, which is a nice, sometimes we call it EXHN14. It's basically, you can just find that one sun posterior to triple burner 17. So if we were to look for Yiming, let's see if I can bring that up. It would be approximately here. Or you might want to go for just triple burner 17. They're using triple burner Sanjiao 16. It's interesting also. Again, another piece of research, pretty 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 intense how much work's been done. Way back to 2014, we had some research on it as well. And we always seem to be finding a little moxa, a little electroacupuncture. We saw some proprietary points used, but always pretty much going around similar. So this is the main article that we were covering, Acupuncture Tinnitus Relief Efficacy Confirmed, but you can see it's not the only piece of research in town helping us find out what we need to know about tinnitus. And we found what? It really comes back to a lot of local stuff. I guess this photo, seeing how much we saw, probably want to add triple burner 17 in there. You saw some Yiming, so this region here. And I hope that's helpful. I feel like we covered a lot in how to benefit the ear and help people really get the kind of results they need as best we can do, and see what works in your clinic for your patients. I think it's really worth looking at and helping people with this condition. Acupuncture Tinnitus Relief Efficacy Confirmed.